The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have one of the founders of Southern California's premier center for dental implants, certainly the busiest center here in San Diego. And with us, we have Dr. Ayers. Dr. Ayers, welcome to the program.
Hi, Randy. Nice to see you.
All right. Now, you are the prosthodontist,
right?
Part of the team with an oral surgeon.
Exactly.
Tell us about your center. I mean, you have a very unique center.
Well, the center was built specifically for dental implants only. That's really all we do in the center.
Is that right? That's it?
Yeah. We only do dental implants. We replace missing teeth, whether you're missing one tooth or all of your teeth. Or for some patients who come in, they still have a few teeth, but they have periodontal disease and they know they're going to lose those teeth. We can replace all their teeth. Actually, we do it in one day.
Okay. Now, so teeth in a day. People can go in with no teeth,
right,
and in the same day leave with teeth.
Exactly. The reason we can do that is we have a 3D scanner in our office in the center where we scan them and we can make a 3D model of their jaws and their teeth, and we plan everything ahead of time. So we plan the actual surgery. Dr. Berger does the surgery on the 3D model, and then because I know where the implants are going to go, my technician and myself then can actually fabricate the teeth ahead of time. So when they come in for the surgery, we've got everything planned. The surgery goes really smooth, really quickly, very atraumatic, and we're able to place the implants in a very precise position, and they leave then with the teeth attached to those implants.
Okay, now, one of the other things in your practice, which I just learned today, that everybody does this while they're asleep.
Yes.
So they're out.
Well, yeah, we have an anesthesiologist who comes in, because we have a full operating room, comes in, puts the patients to sleep, and the implants are put in, and then the teeth are set immediately after that. So the patients really wake up with teeth. So they don't have to worry about multiple visits, going to the dentist and having injections and shots and things like that. We really do this on the same day while they're asleep.
So the permadontics, we were talking off camera, the permadontics difference is what, as you see it?
Well, the key is that we plan everything ahead of time on the 3D model. So we know exactly where the anatomical structures are, which areas to stay away from. We know the amount of bone that we're working with. We know the angles that we're going to actually position the implants. We know the length of the implant, the diameter of the implant. And we also have a surgical guide made that's very precise. So we do everything ahead of time so that at the time of the surgery, everything goes really smoothly and efficiently.
So the person that's actually doing the surgery, so you work together. Okay, so Dr. Berger, we've had on the program, he's a medical doctor, oral surgeon as well.
Right.
And then, of course, the prosthodontist together.
Right.
And this is interesting to me. So you're saying it doesn't cost more to go to a specialist.
Right.
If you're going to get dental implants, it doesn't cost more to go to a specialist.
Right. Because historically what would happen is the patient would go to a specialist and she would go maybe to the prosthodontist. The prosthodontist would then refer her to an oral surgeon, and then she would also be referred for an x-ray, for a special x-ray. Now we have everything in one place. So we're able to make everything lower cost actually than if you were going to all these separate places. And she's got the specialist, the oral surgeon, who has a huge amount of experience. I've been doing this for many, many years.
You guys have like 50 years between you say?
Yes, I've been doing this since 1981.
Okay.
And Dr. Berger also since 1981. And we've been working together as a team actually for 15 years.
Is that right? Okay.
Yeah. So now, because we're all in one center, it makes everything a lot more efficient.
Who is the typical patient, by the way? What are the age ranges of patients coming in for dental implants?
Well, it's interesting. It ranges anywhere from the 30s up until the 90s. We have patients in their 90s who are
90-year-olds are doing this?
They're wearing dentures, and dentures are just really difficult to wear. They move when they eat, they get food underneath them, they get irritated gums.
All right.
A lot of these patients don't even go out because they're scared to go out and eat with their friends because they know they won't be able to eat. They're going to have to jump up and go to the bathroom to clean their dentures out.
Okay.
So these are the patients actually that will gain the most out of it, because we could just do 2 implants and attach the denture to these 2 implants, and right away these patients are able to eat.
Okay.
And that's something new for them that they haven't been able to do, some of them for 10 years or even 15 years.
So even at 90 years old, I mean, there's not an issue with the implants staying in the bone?
No. No, the issue with doing it in a 9-year-old is just to make sure she doesn't have, or he doesn't have, any serious illness. So we
it's not painful? It's not painful?
No, because we numb the patients up and we put the implants in the bone, and the bone itself doesn't have nerve endings.
Okay.
The nerve endings are on the gums. So if we can prevent the denture from sitting on top of the gums, there'll be very little, if any, pain after the surgery.
I told you, you know, I visited your center, and I saw some of your before and afters, and I see a lot of these things all the time, and yours were the only ones at the time that you know, the afters didn't look like dentures, even though that they were fixed and they were dental implants, but your teeth look very real.
Thank you. Well, I sit down with a patient one-on-one and we discuss exactly how they want their teeth to look.
Yeah, how much say-so do they have in that?
They have as much say-so as they want. They can have them look as white as they want, as natural as they want. If they want a little space between the two front teeth, we can give them that. If they want one of their teeth to be a little overlapped, we can give them that.
Do most say, though, I mean, they don't know, they leave it up to you?
Most of them say they want to look natural. So the other key is that we use a tooth that is white, but it's not too bright.
Okay.
You know, when you look at someone and then you know they have caps or crowns,
yes,
it's because it's too opaque looking. There's not enough translucency going on. So when the light hits those teeth, it gets reflected straight back to your eye. And the new teeth that we're using today have amazing reflection abilities. So when the light hits those teeth, it gets reflected, and it looks like a more natural enamel than a fake tooth.
So denture wear watching this, because some of the denture wearers have older dentures. They come in, you give them a more youthful looking smile.
Yeah. When I look at them and I ask them to smile and ask them to go through certain movements, say certain words, I can tell where those teeth have to be. And
we're going to take a quick break. We come back, more about the process, what people can expect on day one, and of course the different options for denture wears. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
When Carol first came to Prosthodontics, she could barely smile. She was very self-conscious.
As a nurse, I was already aware of the great reputation of the doctors at Prosthodontics. That's why I trusted them from day one.
I love what we do here because we see our patients transform and they get their confidence back.
Now I'm much more social with family and friends. Thanks to Prosthodontics, I have my smile back.
You too can get your smile back at Prosthodontics, Southern California's premier dental implant center. Don't wait, call today.
Richard, who is a Vietnam vet, was extremely apprehensive when he came in. Once we showed him the process, it put his mind at ease.
I was concerned about pain, but there wasn't any. I left here with a full set of teeth the same day.
I never get over the joy we see on these patients' faces. It's a new lease on life for them.
Sometimes I have to pinch myself. I've got my confidence back. It's the best thing I've ever done for myself.
See the Prosthodontics difference for yourself. We're Southern California's premier dental implant center. Don't wait, call today.
I had partials, upper and lower. It affected both my personal and my professional life. I was afraid that they were so loose that when I was talking or eating, I would lose them out of my mouth, and I couldn't smile. Now my diet is not limited to cream of wheat. I love eating chicken, and I love steak, and I love all the things that I could never eat before. And I'll never have to worry for the rest of my life.
I had very few teeth left on the top of my mouth. The whole top is upper implant. The bottom is still my own teeth. And so it's a very good match. And today the things I'm able to do is I smile and I laugh with my whole mouth now. I had been forgetting how to do that. I had been hiding behind it. I don't have to put my hand in front of my mouth anymore to hide the missing teeth that was always visible. And I can have things like celery sticks and apples that I previously wasn't able to have, and it's just a whole new me now that I'm able to smile. I wish I had done this years before. It's something that I'm very pleased with. It was affordable. It wasn't out of my range, and it is so much more convenient than the wobbly dentures, so much more pleasant for me and my family.
For many years I've had teeth that were not the best in the world. I'm happy to smile again. As you see, we've got good teeth all the way through, and it's just really a whole new life, actually.
With Prosthodontics, those problems are gone. I had good care, and I got the job done, and I got what I want. I'm really, really happy.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, and we're here with Southern California's premier center, one of the founders, premier center for dental implants. They have a very unique model. They have an oral surgeon, medical doctor, and oral surgeon, and teamed up with a prosthodontist under one roof, and they're doing teeth in one day. People go in there, with no teeth and they walk out with a set of teeth.
It's amazing, isn't it?
Not an exaggeration.
No, no, no. Now,
Right?
15 years ago, we weren't able to do that. But now with the new technology, we're able to actually plan everything ahead of time. And you, for example, you see this 3D model here.
Yeah, what are we looking at there? What is that?
Okay, this is the exact duplicate of a particular patient that we're working on.
Okay.
Because we have a 3D scanner in the office, a 3D X-ray scanner,
Yeah.
we can, from that, we can make an exact duplicate of this patient's teeth and of their jaws. Okay, and because of that, we're able to do the surgery in advance. So we actually can see the bone, we can see exactly where the bone is. We stay away from the areas that we don't want to go into, like the sinus, for example.
Okay.
But we plan everything ahead of time. So the surgery is done twice, actually. It's done once here and then once in the patient's mouth. Once we know the position of where the implants are going to go, you can see this patient.
Let me take a look at this guide. Okay, so we can see this, and those holes represent where the implants are going.
Exactly.
So this right here, so these 5 holes, it just guides right in.
Right. Now,
So
it
this
also
is-
represents the diameter of the implant, so we choose that ahead of time. It represents also the length. Now we can see where the teeth are missing, and the surgery is done into the bone. We can see the bone.
Yeah.
And Dr. Berger puts it in the best position and the best angle. And once he's got the implants in, we make a guide like this, okay? And then he knows the exact position of where to place the implants.
Interesting.
And then once the implants are in, we tie them together. And you know, an arch is a very strong design, right? That's how
Okay.
bridges are made, right? Across
Yeah,
the water, right?
yeah.
So we can make an arch that goes from one side of the mouth to the other. And that's what's the key, is if we can splint the teeth across what we call the midline, from one side to the other, and form an arch, that prevents the implants from moving. Because we don't want the implants to move while they're healing.
All right.
And that's the key. You see, since 1998...
So you could give them an upper set of teeth in one visit?
Yes.
Interesting.
Yes.
Interesting.
And so-
It seems easy, by the way. Now that these guides, it seems like, you know.
Well, it's
made it pretty easy,
It's a lot
right?
easier for Dr. Berger than it used to be.
Okay.
Because for the surgeon, he used to have to figure out where to go. So at the time of surgery,
They kind of feel
he would
around?
actually move the tissue away, and you have to figure out exactly the best position. Now he knows where to go. So actually, his surgery now is very quick.
And then you come in, and then you just put the teeth on top of the implant.
So once the implants are in, I come in, and then I set the teeth. Now, the teeth have been made ahead of time.
All right.
Okay, according to the patient's desire and according to my design, the color, the shape, the size. So we know exactly how they're going to look before. And we can show that to
Do they
the
get
patient.
emotional, by the way, when they see their teeth?
Oh my God, it's unbelievable.
Like
I
what?
get emotional.
You do?
I get emotional because I know what they look like before and I know what they've been going through. A lot of these people have been recluses. They've been staying
Really?
at home. They don't want to go out. They can't eat properly.
Do they tell you that, by
can't-
the way?
Yeah, they do. They don't socialize. And especially as you get older, that's one of the fun things to do is to actually socialize. And everything revolves around food when you socialize.
Okay,
You know,
good
they
point.
go out for lunch, they go out for dinner, whatever it is. And these patients, when I give them the mirror at the end of that visit, that first
Yeah.
visit, and they see their teeth, you can just see a joy come over their faces. And they say things like, "Oh my God, I can't believe it." They start crying, actually.
Really?
Yeah, it's really emotional for everybody. Everybody comes over to watch because they know that it's an amazing moment for these people.
So no more dentures. I mean, is that the future, by the way, of dentistry? Where everybody will have dentures that are holding on to something?
Yeah, that's the future because implants now have been shown to be extremely successful. It's actually the most successful thing we can do in dentistry today are implants. If you look at the studies over a 10, 20-year period, the success rate is in the high 90%. As long as the patients take care of it, they go for their regular cleanings, they have to clean their teeth just like they were their own teeth. We guarantee that it's going to outlive them.
And everybody that gets their dental implants, and this is very, very interesting, everybody's asleep.
Yeah.
And you guys are in a real operating room. Because
Oh,
I know
yeah.
that the doctor
Oh, yeah.
that does the surgery with you, your partner, he's a medical doctor,
Right.
oral surgeon.
Yeah, I think that's what sets us apart from a lot of other dental
very
implant
interesting
centers.
to me.
Is that we do have a full operating room, and we have anesthesiologists.
But it seems like it'd be more expensive with all of this.
Well, the reason it's not more expensive is that we become very efficient because we plan everything ahead of time. Like I said, the surgery itself can take an hour to do 5 implants, and we have an in-house technician. Okay, but all he's doing in our lab, in the center, are fabricating teeth that attach to dental implants. So he becomes very proficient at what he's doing.
One of the things I always think is interesting is what's important to doctors. And you told me, Randy, I want to make sure people know we have this master ceramicist. I think that's what you said.
Right, right.
I mean, why is that important? And I'm saying that respectfully.
Right, well, he's the guy who actually fabricates the teeth. And normally the ceramist or the technician is in another building, in another office somewhere.
Another state, maybe?
Maybe another state.
Okay.
Our ceramist is right there in the lab in our center.
But what does it really mean, though, to the patient?
Well, what it means is I can bring that technician in to the dental chair, and he can see when we're doing a fitting. We call it a fitting. Before it's finally finished, we can see the position in the patient's mouth, and he can see what I can see. Instead of me telling him, change this, change that, make this tooth longer.
Interesting.
He sees it as well.
So permadontist, okay, and I'm not trying to endorse you guys, okay, but I do like that every once in a while that my show could help a few people, okay, because these are real interviews.
You're right.
But people always ask me, Randy, give me a referral for this, give me a referral for that, and I always say the same thing. Look for a specialist, okay?
Yes.
And that's what you guys do.
Yeah. So we have now the two specialists together in one place, which is not really common, especially in San Diego.
All right, now we're going to go to a quick break. In fact, it's one of your patients. Your patients are like ambassadors for you.
Yeah, we love seeing
They
our
act like
patients
they
come
love you
back.
guys.
Yeah, well, we change their lives.
I've interviewed a few of them.
Yeah.
They say that. Okay, we're going to take a quick break. Back to more about the consultation. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. And with us, we have an expert on the topic. He is a prosthodontist, Dr. Ayers, and you're the co-founder of Southern California's premier center for dental implants.
We call it Permadontics because our idea is to give patients permanent teeth. A lot of patients have been told they can have dentures that snap on, or some type of a bar that joins the implants together and the denture snaps on the bar. And we do that for patients, and it's a good value. But what we really specialize in is giving patients permanent teeth that feels just like their own teeth, teeth that do not come out of their mouths.
So that's why you came up with that name?
That's why we have the name Permadontics, yes.
Permadontics.
Yeah,
very interesting.
Teeth, yeah.
How many people in San Diego you think are wearing dentures that don't need to be? Thousands, 10,000, 50,000?
I would guess it's closer to 100,000 of people, because 1 in every 3 people have some type of removable appliance. That's the national average, whether it's a partial denture or a full denture.
I like to ask everybody this, and I asked your partner, if it's so good for a denture wearer to come in and get a fixed set of teeth, why aren't they all doing it?
They don't know about it. I mean, that's why I'm talking to you. I want people to know what's available. A lot of these people went to the dentist 20 years ago, they had their teeth removed, they've been wearing dentures, they think they're done now, that there's no other options for them. So we want people to know that even though they've been wearing dentures for so long, they still have enough bone that we can put the implants in and we can give them a full set of permanent teeth.
So my 76-year-old mother said, her medical doctor, I told this to your partner, said, I don't think you'd be good for dental implants because I think they would fall out at your age, at 76.
Right. Okay. There's no reason that a 76-year-old cannot have dental implants.
Because you've done 90-year-olds.
Oh, yeah. Oh,
right?
Yeah.
And they didn't complain about pain?
No, because when we put the implants in, it goes into the bone. The bone itself doesn't have nerve endings like you think it does. The nerve endings are on top of the bone. So if there's pressure on the gums and on top of the bone with the denture, you're going to get pain. But when you bite down on the implant, there's no pain.
Okay, and you say you're changing people's lives.
We are. We're taking people like this who've been wearing dentures for many, many years. They don't want to go out and eat with their friends. They don't want to socialize. They cannot eat the foods that they used to eat. And now,
so they could eat even like a carrot or broccoli or whatever?
Oh, definitely not, no. They've accommodated to eating softer foods. And unfortunately, some of those softer foods are not really healthy foods.
Okay, could you give us a recap? And I know you have photos you want to show us, but for a denture wearer, they're watching this, they go in. What are the usual options they have to get something either snap in, snap out, or fixed?
Okay, so a denture wearer will come in and we'll say, well, you could do 2 implants and we'll attach a denture to those 2 implants.
Okay.
It's going to help keep the denture in place, and you'll be able to eat better, and it will change their lives. There's still some maintenance problems with those because the denture has to be removed twice a day. It has to be cleaned. You can get food underneath the denture.
All right.
But it definitely is an advantage than not having the implants. The next option from that is to go to 3 or 4 implants, again with some type of a snap-on denture.
Snap in, snap out.
Snap
so
out.
No more glue in any of these cases?
No, they don't
no
need
more
glue.
adhesive?
Exactly. Yeah. And then the third option is what we call permanent teeth. Where
that's your favorite?
That's what we love to do for the patients.
You love that?
Sure, because there's very little maintenance. Because there's no movement going on, the teeth are permanently attached, they're stable. For the patients, That's it. They're done.
So they just brush them like regular teeth?
Oh yeah, just like their own teeth. They got to go to the dentist, have it cleaned, just like it was their own teeth.
No cavities though?
No cavities, and the gum disease that some of them had, that's gone.
So get a fixed set of teeth. I mean, literally somebody could go on 2 appointments and they have a fixed set of teeth.
Yes.
I mean, is that true?
It is true.
They go in, they see you, they get the imaging, and...
Yeah. Well, the day they come in, if they decide they're going to have it done, we right away, we take molds, we take casts of their mouths. We talk to them about how they want it to look. And I have a one-on-one with a patient, and we spend a lot of time how exactly you want your teeth to look. And then the next time they come in, they actually have the surgery done. During that time, while they're away, Dr. Berger and I and my technician are working really hard planning their case. We're doing the surgery on the model. We're fabricating the surgical guide. We're fabricating the teeth. We're getting everything ready so that when they come in, it goes really quickly and very smoothly. So they come in the morning, and by 2 o'clock, they have their teeth and they can leave. Okay, so let me go back to that statement you said about how we change people's lives. This gentleman here, Richard, he was actually a Vietnam vet. He was wearing a partial denture on the top. On the lower, he had no teeth at all. Okay. Couldn't wear the lower teeth. Mostly, he wouldn't even wear it. And he had to find a way to get by, eating a lot of soft foods and really unhappy. Okay, and when he came in to see us, we told him, look, you've got 4 teeth left that are really not that good.
They need to go.
They need to go. We can put 5 implants in the upper jaw and 5 in the lower jaw. And in that same day, we'll attach teeth to those implants. Once the teeth are attached to the implants, you'll have no pain. And when you talk to him,
it's like getting your teeth back.
It's like getting your teeth. And when you talk to him, he admits that he had no pain, even after the surgery. Because we give patients pain medication that day they leave. Often they don't take the pain medication.
Really?
Because now they have no pressure on their gum tissues anymore. So when they bite down, the pressure is now distributed into the jawbone. So it's really remarkable. We're sometimes even surprised how little pain these patients have.
Is that right?
It's really remarkable.
And they're surprised, obviously.
They're very surprised.
Is this one of those things where they just say, you know what, we should have done this years ago?
Oh yeah, oh yeah. They kick themselves because they didn't know about it. And that's why we want people to know what's out there, what's available for them today. Because they haven't been to, a lot of these patients haven't been to the dentist for many, many years. And now when they find out how relatively easy this process is, they do kick themselves, that they should have done it many years ago.
So the Prosthodontics team. So you guys are the hot dental implant team in San Diego.
Well, we've been doing this for many, many years.
You probably have the most experience. You have a very unique setup there.
Yeah.
I like the fact you're working with a medical doctor, oral surgeon, prosthodontist. You have your own lab right there. I mean, everything's done right there.
Right, right. This is not new to us. We've been doing this for many, many years. We've been changing people's lives like this for many years.
So 15 years you guys have worked together?
Well, we've worked together for over 25 years in dental implants.
You guys must be sick of each other.
Yeah, almost.
No, but you guys like working together.
We work together really well because we both have strengths and weaknesses that I think tie in really well together. But what's changed is in the last 15 years, we're able to do the teeth in the same day.
But not a lot of people, though, are doing it. I think that's an important point, that are doing this teeth in a day concept.
No, that's true. That's true. We are unique in that way, that we can do it in the same day. We can give them teeth attached to the implants, permanently attached in the same day.
So you say that the people, the 100,000 maybe people in San Diego that have dentures, if they knew, in fact, do you think if there was a try-in time, like Friday, you guys offered, try dental implants for the weekend, on Monday, do you think anybody could go back to dentures?
Oh no, once they got implants, there's no going back.
Really?
It's like a different life. Yeah. They don't want to go back to dentures. Nobody wants to go back to dentures. Yeah.
Really?
Dentures are really difficult, very difficult, especially lower dentures. Upper dentures, some people get by, but lower dentures, it's just really a horseshoe shape. It's just sitting on the gums. The statistics are that out of people who have lower dentures, 30% wear them but have difficulty eating. Another 30% don't wear them at all. And the other 30% only wear them when they have to, when they go out with their friends.
Okay.
So it's a really high number of people who don't wear their dentures.
Time for one more photo. What do you got?
Well, this is one of my favorite patients. When she came to see us, she really had really bad teeth. And a lot of her teeth were broken down. She didn't want to smile. We actually could not get a smile out of her. We wanted to get a pre-op.
Because she was embarrassed?
Very embarrassed, walk around like this.
Even to a dentist, she didn't want to show her teeth?
Yeah, she was very embarrassed. Yeah, she was a recluse.
Okay.
And she will admit to that. She stayed at home. She never went out.
Wow.
She had no friends. She couldn't socialize. But when we told her the process, that we can get her teeth in one day, you could already see that she had hope. and we really changed this lady's life.
People have to be skeptical when they hear this one day, teeth in one day.
They are. But if we explain it to them, how we can splint everything together and how it works because it's an arch shape, which is a very strong mechanical design, they get it. They understand that it will work. And we tell them our results because we've been doing this for so long.
But you also want to give them a cosmetic result as a prosthodontist. I mean, you make them look beautiful as well.
Yeah, absolutely. They get their teeth and they get a good result cosmetically. Now, some patients really just want to eat.
Okay.
They haven't been able to eat. You know, so men, for mostly men, they just want to eat.
They just want to eat.
They just want to eat. Yeah,
but then they get the bonus of the beautiful smile.
It's an added bonus of improving their smile. Sure.
What do you like most about what you do?
I think it's that I can do something to change someone's life. Because when they come in and you can see the way they dress, the way they carry themselves, they're very, very unconfident about themselves, and they have very little self-confidence. And so we're able to see the change, and it's really dramatic. We put their teeth in, and I have them come back a week later so I can check everything. And when they come back a week later, I can already tell.
Really?
Already tell, especially the women, they've done their hair, they've put makeup on, they've changed their way they dress, the way they hold themselves, and they're smiling. So it's very rewarding for me. It's a real
very
joy.
Good.
It's a real joy to see.
Very good. Very good.
Very gratifying.
So Permadontics, get permanent teeth in one day.
Yes.
All right. I want to thank you so much.
Yes.
I want to thank you for coming on the show. Great stuff. Great stuff.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could put in Dr. Ayer's name on our website at wellnesshour.com, or you could just put in San Diego Dental Implants. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.